Have you ever felt nonplussed or confused every time your dentist reads your x-rays? Hi guys, welcome to Dental.Beyond 101. I am Dr. Mihika, and today we shall be decoding some black and white images so that you too can be on the same page as your dentist as you both read your x-rays together. Now, before we begin reading the x-ray images, it's important to understand what is black or radiolucent and what is white or radioopaque on an x-ray image. Now, it's important to understand that we can only see calcified structures such as bone, enamel, dentin, or metallic structures such as fillings, caps, bridges, implants on an x-ray. Now, when we shoot x-rays to capture the oral tissues, these denser structures tend to block the penetration of the rays through them, thereby giving a white or radioopaque look. The thinner structures such as the lips, the cheek, the dental pulp, blood vessels, nerves, and hollow spaces such as sinuses or tooth cavities let the x-rays pass right through them, thereby appearing dark or radiolucent on the final image. Okay, one final thing to know before we start reading an x-ray is that an x-ray image is a mirror image of our mouth. That means it's inverted. The left of the x-ray image falls on our right and the right of the image falls on our left. Alright, now that we know some basics, let's start reading some x-rays. This is the tooth, with the upper portion being the crown and the lower portion being the root. The enamel and the dentin are mineralized dense structures and hence radioopaque. When tooth decay occurs, the bacteria start destroying the enamel, followed by the dentin, which then starts to show an irregular shaped radiolucent or black cavity. This can be treated by doing a filling. Fillings are often radioopaque or very white and easy to identify for the convenience of doctors. The pulp of the tooth houses the nerves and the blood vessels, basically where all the nutrition comes from. Since it's a soft tissue, x-rays pass right through it and hence it appears dark or radiolucent. If tooth decay is not treated on time, the bacteria could keep growing and eventually make their way into the pulp, causing pulpal inflammation and infection, which often leads to a root canal treatment. During a root canal treatment, it is this pulp space that is cleaned and filled, just like you see in these images. The root of the tooth sits within the bone. Ideally, the entire root must be covered by the bone. During progressive gum disease, bacteria begin eating the bone, which results in lower levels of the bone. As bone levels reduce, the teeth become loose and in extreme cases may even fall out. This can be prevented by regular cleanings at the dental clinic. But not all bone loss is due to gum disease. Sometimes other infections or even cysts or tumors may lead to the bone to resolve. Some of the other things we can identify on a radiograph would be the works of dentists, that is, a cap or a crown, a bridge, or a dental implant, to name a few. Great job, guys! Now that you roughly know what each structure looks like on a dental x-ray image, it's time to see the bigger picture. Let's move on to the panoramic. Now, this is a full mouth x-ray that helps dentists get an overall picture of what's going on in the lower half of your face. Through this, not only can we see the teeth, but also appreciate your upper and lower jaw bones, jaw joints, and sinuses. On the panoramic, these are the molars or the back chewing teeth, the premolars, the canines, and the incisors. And this right here is a dental implant. Sometimes, teeth could be oddly positioned within the jaw bones, and OPGs can help us plan their eruption or removal accordingly. All the lower teeth sit within the lower jaw bone, known as the mandible. A canal-like structure running through the mandible houses an important nerve which is responsible for the sensory supply to one half of the lower jaw. Sometimes, wisdom teeth or other dental diseases come very close to the nerve and can cause potential nerve damage, which means reduced or no sensation of pain, touch, pressure, or even taste from that side of the lower jaw, lower teeth, chin, lower lip, and tongue. This is the upper jawbone or the maxilla. In it, you can appreciate many bubble-like dark structures which represent the nasal cavity and the maxillary sinuses. Sometimes the bone plate between the floor of the sinus and the tip of the tooth roots may be very thin, so doctors have to be mindful during extractions and implant surgeries. In case the bone is compromised, a sinus lift and bone graft surgery may be needed, just like in this case. And these here are the temporomandibular joints. They join the upper and lower jaws and make movement of your jaws possible. Changes in their surfaces may indicate joint problems. Okay, so far we've only seen and spoken about adult x-rays. But how does a child's x-ray look? Does it look like too much is happening? Well, all these small circular structures you see within the jaw bones are actually developing permanent teeth waiting to erupt in a few years' time. Permanent teeth start developing as soon as a baby is born, and as they grow and expand, they start resorbing the milk teeth, replacing them between the years of 6 to 13. So even though the mouth of a child may only house 20 teeth, when you look deeper into the jaw bones, you can actually find 32 more. Alright, so this brings us to the end of today's video. Thank you so much for watching. I hope you guys learned something new. If you did, don't forget to like, share, and subscribe to the channel. Comment down below what topics you'd like me to cover next, and I'll see you in the next one. Boom! Alright guys, bye! X-ray, X-ray, X-ray. What is the purpose? Oh, my mic always keeps coming out. So irritating. Guys.